Greetings, I'm John from Guzip Biomarkers. Today, I'm going to give a 10-minute pitch about our product, MPap Test, a better way for endometrial cancer screening. I will follow the outline. First, why is the problem so important? Second, how to deal with it. And finally, what are the actions for it? Let's talk about the problem. Abnormal uterine bleeding, AUB, is a common problem among hundreds of thousands of women worldwide. For instance, there are more than 800,000 women in the UK and 1,400,000 women in the US who suffer from AUB annually. And the women report AUB are worried about the cause, which may be the result from severe disease. Statistically, there are 5 to 10% AUB are due to endometrial cancer. Meanwhile, endometrial cancer has been an urgent women's health issue, especially in developed countries. According to Global Can 2020, endometrial cancer is the sixth most common female cancer worldwide and in Taiwan. Furthermore, endometrial cancer will be overwhelming in the coming future. By 2040, the incidence is increasing around 46% and the mortality is increasing 62%. We have to face up this issue. Another reason that the women report AUB are worried about is the clinical examination. In order to tissue sampling for diagnostics, these procedures, including PAPL, DNC, and histoscopic, are highly invasive. However, the examination have some limitations. For one thing, this IVP could be inefficient. More than 90% recipients found no or indolent cancer. According to Taiwan National Health Insurance dataset, in average, there were 30 IVPs performed for one EC detection. Further, in low-risk group aged under 40 years old, it took 137 times IVPs for one endometrial cancer detection. Middle to high group aged 40 to 50 years old, 87 times. Even the highest risk population, age equal or above 50 years old, it still takes 16 times IVPs for one endometrial cancer detection. Given this point, the efficiency of IVPs still have room for improvement. For another thing, this sampling could be failed. Non-diagnostic and insufficient sampling rate are high in specific populations, such as elder or postmenopausal women and patients with higher BMI. With regards to this, here's our solution. First, based on the characteristic of AUB, we could collect sampling from cervix. That's to say, we choose traditional and minimal invasive pap smear and thin plate for sampling. Second, cyclic change of endometrium is associated with epigenetic regulation, such as DNA methylation. And the DNA methylation is the main mechanism of tumor genesis. Therefore, we use novel technique, DNA methylation biomarkers for endometrial cancer detection. The combination of minimal invasive for sampling and DNA methylation analysis on endometrial cancer detection is promising, and the preclinical result has been published in 2017 and 2019. In addition, our product MPap test could provide a reliable result. The sensitivity is 91% and specificity is 73% from the latest multi-center validation study. In brief, MPap test could be an alternative method instead of directed IVP for endometrial cancer. The advantage is not only minimal invasion and no need to anesthesia, but also it could provide reliable results. Although there are few competitions, MPap is still in the bag. We focus on the woman age equal or about 40 years old with abnormal uterine bleeding. By minimal invasion for sampling and the novel DNA methylation analysis, it only takes you 1 week. MPap test is a minimal invasive, time-saving, and cost-effective tool for endometrial cancer detection. In the latest part, we are going to demo some MPap applications for you. The overall process of MPap is easy to understand, 4 steps only. First of all, consult the physician. Next, specimen collection in the office. And then, performing DNA methylation analysis in the lab. Finally, the report will be sent back to the physician. You may discuss in the next appointment. By doing so, MPap could provide minimal invasion, accurate, and a fast result. Returning to the big data analysis. Women aged equal to 40 or above, in average, you still need 28 IVPs for one endometrial cancer diagnosis. However, after MPap triage, we could detect one endometrial cancer within only 9 IVP operated. In other words, the efficiency was 3-fold elevated. Also, the patent of MPap has been granted in 5 countries. To sum up, MPap test has 3 features. First of all, we focus on endometrial cancer. It could fulfill unmet medical need. It is the first-in-class potential product, and the benefit could be reducing unneeded IVPs for you. Second, as mentioned earlier, core technology of MPap test is novel, based on DNA methylation analysis and combining with minimal invasive sampling. MPap test provide not only reliable but also cost and time-saving results. Third, a patent granted in 5 countries and pending on 18 countries. Altogether, MPap test is a better way for endometrial cancer screening. So, don't worry about bleeding. Use smart and painless screening. And this is my last slide. Please feel free to contact us. Thank you.